Welcome to the third installment of the Physician Leaders Network Patients Medical Home and Your Practice webinar. Speaking today, this is Mark Watt from the Alberta Medical Association, and I'm joined by my silent partner, Dr. Jordan LaRue. In our previous two installments, we had spoken about the patient's medical home, the what and the why in part one. In part two, we spoke about what are the behaviors, and an in-depth look at, when we're talking about implementing patient's medical home, what kind of changes are we making, as well as some specific stories and examples, perhaps to either inspire you or to encourage you to share your examples of your transformation towards a patient's medical home. Here in our third installment, we are going to talk a little bit around the supports available to practices to continue their progress towards a patient's medical home. First off, we wanted to talk about the practice level patient's medical home assessment. As referenced earlier, this assessment tool was developed based upon the Safety Net Medical Home Initiative. So it assesses the implementation elements that we reviewed earlier. This assessment has been designed to be used with the support of an improvement facilitator, someone who can help guide teams through their assessment and through some of their action planning steps. If repeated at regular intervals, this assessment is one way that we help a practice track their overall patient's medical home implementation progress. And this approach has been adapted to be a bit of a roadmap to support practice teams with the implementation of PMH. And again, we had alluded to this earlier, but really the Safety Net Medical Home approach was to look at 65 clinics who had been successful in implementing parts of the patient's medical home. And these practices were across 5 states in the United States. And had participated for 5 years. So this really comes from a position of those who have gone forward and are helping us with a dedicated path forward. So the first thing to do is to do an assessment to see if your practice is ready to start a PMH practice assessment. And there's a readiness toolkit that helps describe some of the factors that should be considered before beginning. Ideally, it is completed by the practice leader with the support of a practice facilitator to really gauge the current readiness in the practice to begin working towards a patient's medical home. Then there is the full assessment, which is broken into Phase 1 and Phase 2. Phase 1 is the first 3 elements of the patient's medical home, and Phase 2 covers the remaining 5 implementation elements. The results, or the completing both Phase 1 and Phase 2, helps practices develop an action plan for advancing the patient's medical home. Some of the questions that we usually get when we're talking about using the practice level patient's medical home assessment are things like, how long does it take? Who should be involved? What is the outcome of participating in this assessment, and who do I share it with? So what we can say is that the assessment has an individual component where people look at some questions and independently come up with their own assessment. Then the special magic occurs when that group of people comes together, probably over a course of an hour, to review their assessments and engage in a dialogue around how they came up with that assessment. That is where there is a lot of value for teams, is understanding why people ranked certain things differently, and gaining that understanding and having a very facilitated discussion to achieve that is hugely valuable. And so it's about an hour and 15 minutes of time for those members who would participate, broken up between Phase 1 and Phase 2. So who all should participate? Well, ideally, you would want as many team members as possible on your team to participate in the assessment. Having multiple perspectives really provides a well-rounded discussion for teams. So other physician members of the practice, nurses, medical office assistants, your office administration, if you have co-located PCN staff or PCN staff who work closely with your practice team, that might be a useful perspective. And if you're involved and have a patient advisor who participates with your quality improvement initiatives, that would be another person to consider for participating in this assessment. And again, as we mentioned, the end outcome is to develop an action plan for your practice. So this is really a bit of a, what is it that we want to do, because we have identified some priorities as a team that would be important for us to work on in order for us to become more patients' medical home-like. And who do you share it with? Well, the assessment and the action plan are ideally for the practice team. It's useful information about your practice and what your team is committing to move forward. However, sharing the action plan and or the results can be very helpful for PCNs, particularly in helping connect you with some supports to make the changes easier. So in a nutshell, the Patient's Medical Home Assessment provides a snapshot of where the team is at on the road to becoming a patient's medical home. For this reason, it's intended that it could be administered several times as a measure of progress. Though what we do know is after the initial completion of the assessment, scores generally get lower on subsequent assessments as teams start to develop a stronger understanding of the principles of the patient's medical home. And so don't be discouraged if that happens to your practice team. It's also important to remember that this is not an assessment for judgment. This is your information, and it's used for your planning and helping you identify your next area of focus within your practice. Not all teams need the practice level patient's medical home assessment. If you already have a clear action plan and priorities to help advance you on your journey towards a patient's medical home, perfect. Keep using that. If you find that you are stuck and you're not really sure how to take the next step, then this tool might be a helpful tool to get you unstuck and back on track towards patient's medical home. So the end outcome, of course, is the development of an action plan. This comes about as the team reviews their assessment scores, and they look at areas in which they may have a strength and areas in which they really wish that they could be doing some focus work to improve their ratings. This is a facilitated discussion that helps the team come to consensus on what are some of the important pieces of work that would really help this team move forward. And it's meant to identify no more than about 1 to 3 priority areas based upon gaps and perhaps some of the supports that are available in the system right now to improve upon those gaps. We know it's important that you link those priorities to clinical areas of interest. So trying to do administrative improvements for the sake of administrative improvements can be a hard thing, but if we can tie this to actually seeing some improvements in the clinical service that we provide to patients, we know that this helps teams continue to make progress, because it is rewarding to see the efforts bear out in terms of improved clinical outcomes. The action plan ideally develops targets, roles within your team to achieving that, as well as some specific timelines to keep you on track with your progress. And altogether, that completes the Patient's Medical Home Action Plan. The other major advantage of completing a medical home assessment is it helps provide focus for your efforts, as well as identify potential supports. Currently, many practices report feeling overwhelmed by the vast number of potential opportunities to participate in projects or initiatives. We have some of those listed here on the screen right now. And instead of being bombarded and overwhelmed by all these opportunities, having a clear set of priorities to help you advance your patient's medical home objectives helps you become a bit more selective in terms of what supports would you choose to participate in, because it's helping you meet your practice goals. And there has been an ongoing commitment by AMA programs and key partners in pointing the program supports at the patient's medical home, and specifically linking some of the improvement opportunities to elements within the patient's medical home, so that practice teams can see more clearly what types of programs and initiatives can help them achieve their specific practice goals. At the end of the day, making it work for your practice is what this is all about. Right now, the system is organizing the supports for PCNs and practices differently so that you are in a better position to advance your clinic towards the patient's medical home model. And aligning our tools and resources to support your priorities is the way in which we are choosing to do this. Supports available to your practice, primarily starting with the primary care networks as the first point, as many PCNs have developed programs to reach out to physicians to make them aware of local resources and local programming that can help them with patients' medical home. There are additional provincial level supports that are available that come through your PCN or offered to your PCN. So things like Alberta AIM, the Alberta Screening and Prevention Initiatives, as well as some direct supports that your practice can access. Things like the Health Quality Council panel reports, developing some quality improvement capacity by looking at groups like the Institute for Healthcare Improvement and reviewing the model for improvement, accessing self-help support for your EMR through the Toward Optimized Practice EMR tips and tricks. And so that there are a variety of supports available that can be aligned to the specific improvement activities that you're choosing to undertake within your practice. That brings us to a close for our three-part series on patient's medical home and how it can serve your practice. As a reminder, these webinars have been brought to you by the Physician Leadership Network in partnership between the Alberta Medical Association, Alberta Health Services, and the Alberta College of Family Physicians. On behalf of Dr. Jordan LaRue and myself, Mark Watt, thank you so much for listening to this webinar. Have a great day.